Welcome back to the Best PT Podcast. This is episode 15, talking about ambulation. Some different assistive devices. Parallel bars. Bars should allow 20 to 25 degrees of elbow flexion and should be 4 to 6 inches in front of the body with 20 to 25 degrees of elbow flexion. Walkers. Hand grips should allow 20 to 25 degrees of elbow flexion, and walkers should be used with a 3-point gait pattern. Axillary crutches should land 6 inches anterior and 2 inches lateral of the foot. Crutch height should be no more than 3 finger widths from the axilla. Hand grips should allow 20 to 25 degrees of elbow flexion, and they can be used with a 2-point, 3-point, 4-point, swing to, and swing through pattern. Loft strand, or forearm, or Canadian crutches. Hand grips should allow 20 to 25 degrees of elbow flexion, and they should land 6 inches anterior and 2 inches lateral of the foot. They can be used with a 2-point, 3-point, 4-point, swing to, and swing through pattern. Canes. The handle of the cane should meet the ulnar styloid process. Hand grips should allow 20 to 25 degrees of elbow flexion, and canes can be used with a 2-point, 4-point, modified 2-point, and modified 4-point pattern. Some levels of weight bearing. Non-weight bearing. No weight is allowed through the involved extremity. Toe touch weight bearing may use toe tap just to assist with balance. Partial weight bearing, a set amount of weight, usually in a percentage, is allowed to be put on the injured extremity. Assistive device is required. Weight bearing is tolerated. The patient determines their own weight bearing based on comfort. Assistive device may or may not be required. And then full weight bearing, assistive device not required. When guarding, guard from the affected side and slightly behind. Mimic the patient's gait pattern and avoid grasping the arms as it can interfere with balance. A few types of gait patterns. A 2-point pattern using 2 crutches or 2 canes. Patient moves the left crutch and cane forward while moving the right leg forward simultaneously, and vice versa. Each step is considered 1 point and a complete cycle is 2 points. 3-point gait pattern is used with a walker or crutches. The assisted device advances, followed by an injured leg while placing upper extremity force through the assisted device and then advancing the uninjured leg. Assisted device in each leg are considered separate points of contact. 4-point using 2 crutches or 2 canes. The lower extremities do not move simultaneously with the assisted device. This is useful for patients with impaired coordination, balance, or strength deficits. A swing-to pattern involves the lower extremities advancing to the point of the assisted device, while a swing-through pattern involves the advancement of the lower extremities beyond the assisted device. Ascending stairs or curbs. The therapist should stand opposite the handrail and behind the patient. If there is no handrail, the therapist should stand behind the patient and slightly towards the affected side. Attempt to surround the patient with your base of support, and do not move while the patient moves. Descending curbs or stairs. Stand opposite the handrail and in front of your patient. If there is no handrail, stand in front of your patient and slightly towards their involved side. Attempt to surround the patient with your base of support and do not move while the patient moves. That's it for episode 15, talking about ambulation. Episode 16 will talk about medical equipment. As always, the outline will be in the show notes. Thanks for joining me.